Welcome to Healthy Nation. I'm Dr. Holly Atkinson. If you're a diabetic, you're probably aware that the question of how tightly to control blood sugar is a controversial topic. I sat down with Dr. LeRoith, Chief of the Endocrinology, Diabetes and Bone Disease Department at the Mount Sinai School of Medicine, to talk about the controversy and what's best for type 1 and 2 diabetics.
There's a lot of discussion in the press about these issues, but what's not spelled out to the patients is if you take the type 1 diabetic, blood sugar control is critical. It's been shown in some of the best trials that tight control prevents or delays the progression of eye disease and kidney disease. And in fact, years later, after the trials are finished, those type 1 diabetics who are well controlled had less cardiovascular disease 10, 15 years later. So it's unquestionable in type 1 diabetes it's critical. In the type 2 diabetics, the controversy has been about tight glucose control and cardiovascular outcomes. What was forgotten there is that retinopathy and other aspects of the microvascular disease, the small vessel disease, that was prevented. So tight glucose control is important for both type 1 and type 2. Regarding the cardiovascular outcomes in type 2 patients, the interpretation of most physicians and investigators in the field of diabetes is that early in type 2 diabetes, tight control will give you a positive outcome. But late in the disease, after many years of already having diabetes, you're surely going to have some underlying cardiovascular disease. Or if you already have evidence of cardiovascular disease, then one should be much more careful at how rapidly you bring the blood sugar under control. And that led to some of the complications in those trials because much older patients were used with established cardiovascular disease. We measure tight glucose control by measuring the A1C, because this is a measure that's done every 3 or 4 months, 3 or 4 times a year. And this gives us an idea of the level of the blood sugar over the previous 3 months. And the American Diabetes Association suggests that you try and reach a level of 7 or slightly less than 7. The American clinical endocrinologists believe you should get down to 6.5. But if we could get more patients down to 7, or even just below 7, we would have a much better outcome in terms of the general population of diabetics. It used to be a mean of, say, 9. Now we have the average one is down 8 or slightly less, but we still find that about 50% of our patients have not reached the goal, which is, let's say, 7% A1C.
Why is that?
Because there's so many variables. When you're overweight, you're insensitive to many of the medications, like insulin. Taking the medications some good medications may be expensive because they're new on the market. The difficulty with losing weight, with diet control, and sometimes it's just the body just doesn't respond as well as you'd like it to. Especially when you're aging, one becomes more resistant to many of these effects.
So here's the insight. Tight blood sugar control for type 1 diabetics is critical. For type 2 diabetics who are newly diagnosed, tight control is also critical. But if you've had type 2 diabetes for a while, you'll need to be careful about how quickly you bring your levels under control. Be sure to work closely with your doctor on the right strategy for you.